In this profession, you hear some interesting things about how people get hurt or how they have their aches and pains. One very common thing that I hear is somebody who goes to bed, they feel fine, no pain, but they wake up and their neck is really painful. It's pinching, they may get some shooting type pain to their arm or hand, like that pinched nerve type of feeling. And it's like, how do you explain this? You went to bed, you felt fine, you wake up, and you're hurt. So there's only one logical explanation for this. And it's when you get attacked by the pillow monster. Let's talk about the pillow monster. Basically, when you go to sleep and you wake up and you have pain and you didn't have it before, did you really get attacked by a pillow monster? There's a small chance, but I don't really completely think so. But here's a way to check yourself to see if you're at a potential risk for having neck pain when you wake up. So the biggest predictor for future injury is lack of range of motion or being tight. So let's talk about standard neck movements. You should be able to look straight down and touch your chin to your sternum without opening your jaw, like this. You should be able to look up to the ceiling without any pain or pinching in your neck, and your head should get back to 0 degrees, like this. You also should be able to touch your chin to your clavicle on both sides without opening your jaw or without raising your shoulder, like this. And you should be able to look left and right with about 80 or 90 degrees of range of motion without any pain, like this. So try those out, see how they feel. If you didn't pass one of those tests, there's a chance that you have some tightness. It might be benefited by working the muscles and things like that, and you might be at a risk for having an injury when you go to sleep. Now let's talk about how to fix that. If you are someone that wakes up with neck pain, what can you do? If you're a side sleeper, the main thing you want to think about is keeping your head in a neutral position. That means when you're sleeping on your side, and you sleep on your shoulder, make sure to try to sleep on the back of the shoulder, not on the directly on the side pushing in. It's a little better for you. Maybe hold a pillow, and make sure your pillow is not making your head tilt like this, or if your pillow is too big and your head's tilting this way. You want your head down the middle in a neutral position. If your head is tilted one way or the other for too long, then certain muscles get shortened all night and certain muscles get stretched or lengthened all night, and that imbalance or asymmetry for a long period of time is what causes your neck to be tight and painful. So head down the middle. Also, you want to make sure you sleep with a firm pillow. I know a lot of people don't like them, but the more firm the pillow, the more your muscles can actually relax and the less they have to work. So if you don't like a firm pillow, you can put a thin, soft pillow on top of that to give it that comfortable effect. But the more firm the pillow, the less the muscles have to work, the more they can relax. If you're a back sleeper, if you sleep on your back, it's sometimes tough to not have your head roll one way or the other. They do make cervical neck pillows that actually cradle your head, so you do keep it in that neutral midline position. Face down sleeping, I know a lot of people love that. It feels good, but it's really bad for you. Obviously, for your neck to be turned one direction all night, I don't recommend that. So go ahead and make sure, check yourself out for your range of motion, see if you pass all that. If you don't, make sure you sleep in the correct way. If you need help, we're always here to help you. And just, have a good sleep and stay away from the pillow monster.